10 signs of cancer most women ignore.
Cancer may not be on your radar, especially if you're relatively young and healthy. But it should be, regardless of your age or family history. Women's bodies are very complex as they go through a lot of changes from menstrual cycles to menopause, pregnancies, and everything in between.
Unfortunately, some of the changes that women go through may seem normal, but in actuality, they're not.
In some cases, these symptoms can be cancer signs. Because of this, it's important for you to monitor the changes your body goes through and educate yourself about these changes by consulting your doctor. Here are 10 cancer symptoms that most women tend to ignore.
Number 1. Changes in your breasts.
Most breast cancers are detected by women themselves during routine daily activities like bathing, shaving, or even scratching. Be on the lookout for lumps in the breast or armpit. Make sure there is never any nipple discharge, and the discharge could either be bloody or clear.
Check your nipples regularly and make sure that nipples don't point inwards.
Pay close attention to the skin on your breasts and make note of any changes.
And also, stay alert for any changes in the look and feel of your breasts.
Number 2. Abnormal periods or pelvic pain.
Most women have the occasional irregular period or cramps.
But persistent pain or changes in your cycle can be a sign of cervical, uterine, or ovarian cancer. Vaginal or rectal bleeding is usually ignored by women between period bleeding. Or sometimes bleeding from the GI tract can be mistaken for period bleeding, especially if you don't have a regular menstrual cycle. More than that, unusual bleeding signs can often be so scary that women don't want to admit they need serious checkups. Go see your doctor if you're spotting between your periods or have a bloody, smelly discharge.
These things are usually caused by an infection.
But sometimes, they're a sign of cervical, vaginal, or endometrial cancer. If you've gone through menopause and you notice any bleeding, see your doctor right away. That's never normal.
Number 3. Unexplained weight loss.
If you're overweight or obese, losing weight by exercising and making healthier food choices can actually help curb your cancer risk. But if you suddenly lose more than 10 pounds without changing your diet or exercise habits, talk to your doctor.
Number 4. Extreme fatigue.
This fatigue isn't similar to how you feel after a long day of work or play.
This is an extreme kind of fatigue that doesn't get better with rest, and it could be an early sign of cancer. Cancer uses your body's nutrients to grow and advance, so those nutrients are no longer replenishing your body. This nutrient theft can make you feel extremely tired. There are lots of underlying causes of fatigue, and most of them are not cancer-related.
If your symptoms are severe enough to affect your quality of life, call your doctor. Before we go any further, if you have found this video useful thus far, please go ahead and hit the like button.
Your one like will go a long way in helping others discover this video. So thank you for that, and now let's get back to the video. Number 5. Frequent fevers.
Fever can be a common symptom of cold and the flu, and clears up on its own. But certain characteristics of recurring fever can be an early symptom of cancer. You should pay particular attention to your fever if
a fever happens mostly at night. You have no other signs of infection and yet your fever persists.
Or you experience night sweats. Number 6. Difficulties swallowing and heartburn. If you feel as though food is getting stuck in your throat or you have trouble swallowing for more than 2 weeks, this can be a sign of throat, lung, or stomach cancer.
Number 7. Changes in bathroom habits. We all have diarrhea or constipation from time to time.
But if you notice a significant change in how often you go to the bathroom, then it's time to talk to your doctor. Warning signs include persistent constipation or diarrhea, black or red blood in your stool, black, tarry stools, more frequent urination, and blood in your urine.
These changes can signal colon, prostate, or bladder cancer. Number 8. Skin changes.
Our skin is the largest organ of our body and can be a window into our overall health. Pay attention to any moles that are asymmetric or change in shape, color, or size, as that could be a sign of skin cancer like melanoma. To remember which changes are cause for concern, use this easy mnemonic, ABCDE. A for asymmetry.
where the mole is asymmetrical and one half looks different from the other half. B for border. When the mole has a border that looks irregular or fuzzy instead of a well-defined edge. Color. A mole has multiple colors, including brown, black, tan, pink, red, or even white and blue. D for diameter. When a mole is bigger than 6 millimeters across or roughly the size of a pencil eraser. And E for evolution. When the mole is continuously evolving, it's changing color, size, or shape. Number 9, pain. Pain is another symptom that can be caused by a multitude of health issues, most of which are not cancer. But persistent pain anywhere in your body that has no clear cause and doesn't respond to standard treatments should be evaluated, as it could be an early sign of underlying cancer growth. Cancer can cause pain in the following ways. When a mass or tumor is pushing on other areas of your body. Pain can be because of the chemicals a cancer releases, or because of metastasis, or the spreading of cancer from where it started. If you're experiencing pain that doesn't go away, and you're not sure where it came from, you should consult your doctor for the best next steps. Number 10, chronic cough or hoarseness. A chronic cough or hoarseness that lasts more than 2 weeks could be a sign of lung cancer. And if you're coughing up blood or also experiencing chest pain or shortness of breath, don't wait to reach out to your doctor. It's important to pay attention to your body and how you feel. While these symptoms are also commonly associated with several other causes and conditions, it's important that you speak to a doctor, especially if symptoms last for 2 weeks or longer. Thanks for watching. If you found this video helpful, give it a thumbs up and subscribe to our channel for more videos like this. Also, be sure to check out our other videos as well.